I'm Kira Morgan. Thanks for joining me on Pacific Northwest News and Entertainment for Health Talk, sponsored by Lincoln County Health and Human Services. And today I'm delighted to be with Jennifer Versteeg. Jennifer, tell us a little bit about yourself and what you do.
Well, I've worked for Lincoln County for 18 years. I'm currently in the role of the Prescription Drug Overdose Coordinator for Linn, Benton, and Lincoln counties, and I'm working to prevent opioid overdose, and we're also starting to work on methamphetamine overdoses.
Is that something that's hugely seen in the Tri-County area?
Yes, especially in Linn County right now, but we're very concerned about people who are using methamphetamines and having it laced with fentanyl, and they're not knowing that that's what they're getting, and so we are seeing an increase in numbers of overdoses.
And what are some things that you're working on to help folks who do overdose?
So one of my biggest roles is making sure that all law enforcement in Linn, Benton, and Lincoln counties are trained in carrying Narcan, which is the name brand for naloxone, and that drug reverses an opioid overdose immediately by getting the opioids out of the system or off of the receptors for a little while, and so that they can be resuscitated.
And let's talk a little bit about that. You also, besides just supplying it to the law enforcement agencies, you also provide some training for them as well?
So law enforcement learns better from law enforcement. So in each agency I have a trained officer who trains his own, and so that's kind of how we get it out.
Okay.
And we have a website that they can order it from when they're running low, and then that way I track all of the naloxone that's available in Linn, Benton, and Lincoln counties. So if something were to happen and we had a bad batch of drugs come in laced with fentanyl, it might take out one or more than a few people all at once, and we will need to get a lot of naloxone wherever that's happening quickly. And so that's been a partnership with Chance and the Tribe and Samaritan.
And you work with the Tribe and Samaritan on other projects as well, right?
I do. We recently received $1 million HRSA grant, and what that will do is that's going to help us develop a medically assisted therapy or treatment here in Lincoln County through our federally qualified health center, the community health center here. So I'm excited about that.
So what will that entail?
So hopefully, what we're hoping is we have a certified peer recovery mentors that meet overdose victims in the hospital if they come into the emergency rooms, and they'll be offered treatment, and that peer recovery mentor will not only help them make the appointment but make sure that they get there and they have the support that they need. There's a lot of stigma around addiction and mental health and all of it, and a lot of people who come in with overdose don't feel comfortable talking to doctors, and so it's
a lot of fear involved, right?
A lot of fear and just stigma. I think that they a lot of times feel that people are looking down on them, and so this recovery mentor will also help be their voice, so they don't have to tell their story over and over again.
That's important.
Yeah.
And you're also doing some work in regards to AIDS and needle exchange, is that right?
So yeah, we have a regional harm reduction coalition that meets monthly, and it rotates. Sometimes it's in Linn, sometimes it's in Benton, and sometimes it's here, and that group consists of lots of people who are working to prevent communicable diseases from IV drug use. We're looking at hepatitis C, HIV, and of course I'm there because of the overdose prevention, and so I make sure that our harm reduction workers have naloxone when they're out in the community, so that they can distribute it to the drug-using population that they work with.
And how important is that to get that information out to those folks?
It's very important. We're seeing HIV rates going up. We're seeing Hep C rates going up. One project that I'm hoping to get going soon is to have people tested when they come in for overdose for both Hep C and HIV, along with whatever blood work that they have to run, because there's a lot of people that are or have Hep C and don't even know.
And let's talk a little bit about the issue of heroin and opioid use. You mentioned that it's really high. You mentioned Linn County. How does Lincoln County look?
Well, the reason I'm here in this position is because we were chosen because of our high rates from the state, and the state provides funding through the state opioid response grant that they get from SAMHSA, and that was one of the reasons that that we got chosen, was that our rates are higher per capita than most other communities.
What is it that gets folks addicted to these opiates? Is it just, can you get addicted just by having a prescription for pain relief? I mean, that sounds kind of scary.
Absolutely. It's all over the national news that the pharmacy industry is being sued because of it, for telling doctors that it wasn't, that people couldn't be addicted. But people absolutely can, and there are a lot of other alternatives to opiates for pain. It shouldn't have ever been prescribed for chronic pain, and historically that's how people with chronic pain have been treated in the past. So for more information on that, you should check out healsafely.com, and that's it gives different stories of patients and being prepared beforehand. If you know you're going to have a medical procedure done, that you have a plan when you go in to talk about opiates before it happens, and what you'd like to see in your recovery.
So are there other alternatives? For instance, if you're going in for surgery afterwards, you're really sore, you're in a lot of pain, but a lot of people that I know are afraid to take anything, and they're really suffering, and it can inhibit their recovery.
Right. So as Americans, we've been taught that you should be a 0 on the pain scale, and that pain is the 5th vital sign, when that's not necessarily true. We are going to experience some discomfort, and it is okay to hurt sometimes, and there are alternatives. Ibuprofen, it's great for swelling, and usually it's inflammation that causes that pain, and they've shown that it can be just as effective as an opiate.
All right, Jennifer, is there anything else that you'd like to add or talk about?
No, I think that's it.
Wonderful. Well, thank you so much for joining me today on Health Talk, sponsored by Lincoln County Health and Human Services. I'm Kira Morgan for Pacific Northwest News and Entertainment.